I am Dr. Rodríguez-Feliz, board certified plastic surgeon, and today I want to talk to you about a particular case that we published in our social media, and we received a lot of comments and questions. And as you can see, this is actually the before pictures when she presented to my office, and she actually came with lips that didn't fit. They were too large for her facial features. And she had been in Miami for vacation. She couldn't go out and she was hiding. She didn't like the way she looked. And as we talked to her, we realized she had about 2 cc's of hyaluronic acid injected in one session into her lips. And the main problem here is her upper lip. It was too big for her. So what we did we treated her with Hylenex, which is the brand of one of the type of hyaluronidase, and we treated her in one session. And after multiple injections in particular areas where I wanted to improve, then we were able to basically reduce the swelling on her lips and give her a much better shape, something that fits her face. I concentrated myself on injecting the Hylenex that we just talked about into the lip border or the vermilion area, and I also basically injected the Hylenex into this area. So ideally you would want the tubercles on the lower lip to rest like kind of in a nice area here in the upper lip. So basically that's what we were able to do, and most of the time actually we have to do multiple sessions to get to this result. In this particular patient, we were fortunate to just need one session, but we actually use about, I would say, 3 mL of the Hylenex. And so you can see here now there's much less of the lip filler on the vermilion border on the upper lip, also much less on the lateral aspect of the upper lip, and now you can see how the lower lip tubercles, they kind of rest in a much better space here in the upper lip. And we did resolve some in the lower lip, but we tried to keep some fullness. And this is just a perfect scenario where too much, it's not good, and it can change someone's facial expression. And that's why it's so important when we're doing any of these treatments to consider the patient's overall facial features to understand what's the best way to treat them.